Good afternoon, everyone, and thank you all for joining us today. Welcome to our webinar, Boosting Patient Engagement and Practice Efficiency, a guide to high-performing GP websites. We know that practice managers like yourselves are under immense pressure, juggling rising demand, staff shortages, and increasing digital expectations from patients. And with the NHS driving forward its digital transformation strategy, your GP website is no longer just a digital notice board, it's the front door to your services. Today, we will explore how your website can support NHS best practice, practical ways to improve patient engagement, real examples of practices saving time and money, and the digital tools making the biggest impact across primary care. We've also prepared a free guide for all attendees, packed with insights and a step-by-step guidance. If you have any questions as we go, please feel free to drop them into the chat on the left-hand side of your screen, and we'll cover them in the Q&A at the end. I'll now hand you over to Holly Richards, our lead trainer at Silicon Practice, who will be taking you through today's session. Let's get started.
Hi everyone, thanks for joining the webinar. So as my colleague Lauren's just said, my name's Holly. I'm the lead trainer for Silicon Practice. So I'm going to be guiding you through today's session. We're just going to be covering how GP practices can enhance their digital presence to improve patient engagement and streamline operations. So the NHS is rapidly advancing its digital healthcare agenda. And a practice's website is now more than just an online presence. It's the digital front door to primary care services. And with increasing patient demand for online healthcare services, having an optimized, accessible and secure website is critical. So by the end of this session, hopefully you'll gain insights into the essential features of high-performing GP websites, NHS guidelines for excellence, and real-world case studies demonstrating the benefits of digital transformation. We'll also introduce a comprehensive guide that provides an in-depth view to providing GP websites aligning with best NH practices. So as Lauren said, if you've got any questions, feel free to drop them in the chat and we'll address them during a Q&A at the end of the session. So let's get started. So the healthcare sector is undergoing a digital revolution, and according to NHS Digital, more than 28 million patients in England are now registered for GP online services, with over 90% of GP practices offering some form of digital access. Websites play a crucial role in modern patient interactions. They're no longer just static pages, but interactive platforms providing self-service tools, appointment requests, repeat prescriptions, and access to health information. Research shows that up to 70% of patient interactions can be handled digitally, reducing administrative workload for practices by an estimated 30%. So the key question we must ask is, are GP websites equipped to handle this shift effectively? Current GP websites suffer from poor navigation, slow load times, and non-compliance with NHS accessibility standards, which makes it harder for patients to access services online. So an optimized GP website doesn't just improve efficiency, but it also enhances patient satisfaction and ensures compliance with NHS digital transformation goals. Many GP practices are still struggling with an overwhelming number of phone calls, leading to long wait times and increased frustration for both staff and patients. According to NHS England, 45% of patient calls to GP surgeries are related to simple administrative tasks, such as requesting appointments or requesting prescriptions, and tasks that could be easily automated through a well-designed website. A study by the British Journal of General Practice found that digital interactions reduce the number of unnecessary in-person visits by 25%, freeing up GP time for more critical cases. Despite these potential benefits, many GP websites are outdated, difficult to navigate, and lack integration with NHS digital services such as the NHS app. And furthermore, accessibility remains a significant concern. An NHS audit found that over 60% of GP websites fail to meet web content accessibility guidelines, which makes it difficult for patients with disabilities to use them effectively. These challenges highlight the need for a strategic approach to improving digital access and service delivery in primary care. So to address these issues, NHS England has established a 4-stage framework for enhancing GP websites: planning, improvement, migration, and maintenance. The planning phase involves assessing the current website's effectiveness, identifying pain points and setting goals based on patient feedback and operational needs. And the improvement phase includes implementing accessibility, usability, security, and functionality enhancements to ensure the website meets NHS digital transformation standards. Migration is critical for practices moving to a new website provider, ensuring seamless integration with NHS services like the NHS app and patient record systems. And finally, the maintenance phase focuses on regular updates, security patches, and performance monitoring to ensure long-term efficiency. So by following this framework, GP practices can ensure their websites serve as effective digital hubs that meet both patient needs and NHS expectations. A high-performing GP website must balance usability, accessibility, content, functionality, and security. The usability means websites must be mobile-friendly, easy to navigate, and load quickly. And studies show that 57% of users will abandon a website if it takes longer than 3 seconds to load. Accessibility means compliance with WCAG 2.1 guidelines is essential. Features like screen reader support, keyboard navigation, and high contrast design ensure inclusivity. Content means websites should use patient-centered language, NHS-approved templates, and keep health information up to date. Functionality means patients expect seamless online services such as appointment requests, repeat prescriptions, NHS app integration, and secure messaging. And security means compliance with GDPR and NHS data protection policies is crucial. So features like encrypted forms and secure patient portals enhance trust and confidentiality. So now let's look at some real-world examples demonstrating the impact of digital transformation on GP websites. Our first case study is a GP practice in Glasgow who implemented our footfall solution and saw a 30% reduction in patient call volumes within 6 months. The integration of online appointment and prescription requests led to significant administrative time savings. The second case study is an ICB, or an integrated care board, in the Black Country, which saved over 34,700 phone calls or visits to its practice reception, which equates to roughly £72,973 in receptionist staffing costs. In its first year, digitally serving over 1.26 million residents. So these examples highlight how an optimized website improves efficiency, reduces workload, and enhances the patient experience. Our guide, Boosting Patient Engagement and Practice Efficiency, a guide to high-performing GP websites, provides an in-depth guide to digital transformation. It covers strategies for implementing NHS best practices, improving patient access, and real-world case studies. And the guide is designed to help GP practices make informed decisions about their digital strategy and to enhance their online presence. If you'd like to download the white paper using the QR code displayed on the slide, or you can either visit siliconpractice.co.uk. So I'll give everyone a chance to scan this or save this code. We will also send a follow-up email containing this link for your convenience. And we would encourage you to explore the insights and strategies shared in the white paper to help you improve your GP practice's website. So hopefully everybody can see that information there. So we'll move on to next steps and Q&A. So before we wrap up, we'll have some questions if anybody has anything. So feel free to put them into the chat. Before we wrap up, there are some key next steps. So you can book a personalised consultation with our team to assess your website needs. So if you want to reach out to us for support tailored to optimising your GP website, feel free to let us know. So we'll open the floor for any questions. Feel free to put them in the chat, and we will be happy to answer anything that comes through.
We have had a question come through. We've had a couple, Holly, if you're okay to answer some.
Absolutely.
Yeah. Okay, so we've had one. What's the best way to assess whether our current GP website meets NHS accessibility and usability standards?
So there is a benchmarking tool that's designed for practices to use to assess their website. So we can provide a link to that in the follow-up email, and I'll also paste a link to it in the chat for everybody to see here as well. I paste it into the Q&A, hopefully everybody can see that there. So it guides you through how to use the tool and how it works in conjunction with the guidance from NHS England. And they do say it takes around 45 to 90 minutes to assess the website. So we actively use it for all of our sites.
Perfect. Thank you, Holly. We've had another question come through as well, which is, what advice would you give to smaller practices with limited admin support when starting their digital transformation?
So I would say there's a number of things that practices can do. So you can, for example, improve communication through flyers in the practice website. So if you're looking to, say, boost your website usage, put posters and flyers up in the practice reception, for example, or maybe promote it through the phone line. So quite often practices will have a sort of online message or a phone message that reads out when the patient phones the practice, and it will give them different options. So if you make patients aware that the website is something that they can use for different queries that they might have, that often does improve the usage of practice websites, as well as just sort of making sure that staff at the practice are aware, they're educating patients on how to use the website, just educating patients generally. And then when they're starting out using the new website, if they're looking to kind of transform their digital triage, you know, booking in with us for, if you're looking to get training, for example, on how to use the product within your practice in the best way, looking at how your staff members can effectively use products, responding to patients effectively, just so that patients are more likely to come back and use the service again, and it gets used more and more over time.
Thanks, Holly. I'm just going to give it another couple minutes just in case any more questions come through.
Thank you. So hopefully everybody can see that link I've popped in the chat there. But as I said, we will put that information into the follow-up email as well for everybody.
Yeah, I can definitely follow up with that link alongside the guide as well, which should hopefully cover everything in even more detail to give you guys some support when it comes to digital transformation and websites. Okay, we've had no more questions come through, Holly.
Yeah, it doesn't look like it.
Fab. Okay. So I know that we finished a little bit early today, so apologies for taking up time in your diary, guys, but yeah, happy to give you 15 minutes back. As I said, we will be following up this webinar with a recording of the webinar with a guide, as we mentioned in the presentation, and also with the link through to the NHS benchmarking and improvement tool. So if you do have any colleagues that you think would find this presentation useful, please feel free to either put them in touch with us, or you can just forward on the recording. But thank you so much to everyone for your time today, and thank you, Holly, as well, for your wonderful presentation. I shall give you all 15 minutes back.
Thank you very much, everyone, and thank you, Lauren.
Thank you. Bye-bye.